Accidents that require immediate attention can happen in an instant. Childcare providers need to be prepared ahead of time to handle situations that may put them at risk for exposure to blood-borne pathogens or other body fluids in order to protect themselves from possible contamination. Children and adults can be infected with diseases that are transmitted through contact with blood or blood-containing body fluids and may not even be aware that they have an infectious disease. For this reason, childcare providers should follow the recommended standard precautions developed by the Centers for Disease Control and Prevention whenever they are faced with potential exposure. When children are injured and bleeding, reactions to care for them need to be swift and prompt. A first aid kit that contains disposable gloves should be handy so that whoever is caring for the child can quickly put on the gloves before tending to the wound. If gloves are kept in a separate location, chances are that the provider will not take the time or might forget to get them before caring for the child. Even though the risk may be small, chances should not be taken. Gloves should be worn every time. Childcare providers should also wear disposable gloves when diapering children to avoid the unnecessary spread of illness, especially if children have been sick with diarrhea or vomiting. Viruses can spread this way. Even when wiping runny noses, it is safer to wear gloves. Gloves should be changed and hands washed before tending to another child so as not to spread germs. This takes extra time, but reducing the risk of illness for children and the caregiver is worth the effort. Special care should be taken when removing the gloves so bare skin does not come in contact with the outside of the glove. To remove gloves, pinch the cuff of one glove with the other hand and begin to peel the glove off inside out. Before the glove is completely off that hand, do the same for the glove of the other hand. Peel both gloves off inside out and discard immediately. Wash hands thoroughly once gloves are removed. If there is a large amount of blood or other body fluids, such as vomit or feces, the child care provider should consider wearing other protective clothing, such as a surgical mask, glasses, and goggles to prevent potential contamination of the eyes, nose, or mouth through splashing. Any clothes or other items that have come in contact with blood or other body fluids should be removed and placed in a plastic bag until they can be washed and sanitized. All surfaces that are affected should be cleaned and disinfected. Any disposable items, such as diapers or gloves, should be placed in a plastic bag with a secure tie and discarded. Key reminders. Make sure the appropriate supplies are on hand, since no one can predict when a child might get hurt or become ill. Know what to do beforehand, since these situations usually require quick reactions. Store supplies in an accessible location and alert staff as to where supplies are kept. Don't take chances. Follow safe handling practices of blood and other body fluids every time.